Hey, hon, have you had any interesting clients lately?
I have had a few interesting clients, but this is a real good one. This gentleman and his wife were a referral from another couple that are clients of mine. And I was warned that when I go see this person, I actually met this person in person, that he was the engineer type. So if you're an engineer, that's okay. And very analytical. Of course, I call myself the Medicare Analyst for a reason because I like to be analytical. But this gentleman took it to the extreme. So he was on a Medicare Advantage plan and considering a new one. I think maybe the previous one possibly had terminated, don't actually recall. But he presented to me quite the spreadsheet, Excel spreadsheet here, front and back, total of 4 pages. And on the left column, he's got all the plan benefits, prescription costs, doctor visits, what you would pay for different services, the mental health visits, inpatient hospital services, outpatient services, emergency room, diagnostic services, rehabilitation, dental benefits, vision benefits, rehab, and then the member protection or their max out of pocket. So he pretty much covered the exact summary of benefits that you would see with any of these. And then he had 3 different plans they're looking at. Not that it's real important, but 2 were with Anthem and 1 was with Humana. And then he had all these comments over here. And basically what he had was what the copayment was going to be and what he would anticipate spending for each one of those benefits based upon his past experience in going to the providers. And so he would have that over here, comments, assume not going, assume twice, assume 3 times. And in the very, very end, he came down with a grand total of what he thought he would spend potentially out of pocket. And in this case, the Humana Choice PPO won the day for him and his wife, and they enrolled into the Humana plan. A couple comments on this. This can be very good to do. I realize that most people would not do it, but you are making some assumptions. So always when picking a Medicare Advantage plan, if you care about the costs, the number one thing is to make sure you have as low as maximum out of pocket as possible. If you need help picking a Medicare plan, Medicare Advantage, Medicare supplement, whatever it is, and you want my help and you live in one of the states I'm licensed in, by all means, reach out to me. I'm Chris Prang, the Medicare Analyst. Make it a great day.